makes up his mind and gets back to us saying, I'm coming, we take care of all the needs that he may have. It starts with arranging for lodging, accommodation, arranging for his flight if there is a need, arranging for interpretation. We make sure that we're available 24/7 the minute he makes his decision to come, in case he has any further questions in mind.
What do you mean interpretation? If he's coming from Romania, do you have any Romanian translators there?
We do have available Romanian translators. We outsource this right now. But we have multilingual patient coordinators that assist the patients. We're all fluent in English, all the staff, not just my team, but all staff, nursing,
because they were trained in the States.
Exactly. Not all of them, but most of them. We have, as I say, 120 full-time staff, 35% of whom are board certified from the United States. So
and how come that tonight we have radiologists and oncologists, double specialty, and cardiovascular surgeon? Why? Because these are the most common...
Centers of excellence. They are among our centers of excellence. But besides these, we have
I presume are the most common cases you receive.
Yes, that we see patients from the neighboring countries. That's true. They're very much in demand because we always get the most complicated cases. Whatever cannot be solved in his or her country due to many reasons, because the lack of infrastructure, there is no advanced technology. So for those kinds of reasons, when there is a complicated case, they are referred to us through the physicians in the neighboring countries. And these cardiac care and oncology are among them.
Have you had cases from Romania?
Yes, we've had cases from Romania so far.
Solved?
Yeah. To do our best, and so far so good. All of them were satisfied patients, as Ms. Narcisa may also.
And you also have high technology. I understand that CyberKnife you could find only in few countries in Europe.
That's correct.
But why? Is it expensive?
It's a new technology, a very sophisticated technology. It is actually a robotic radiotherapy system. It is much different from the conventional radiation therapy devices. For example, if you want to irradiate a patient using conventional radiation therapy devices, you should give radiation in 3 or 4 fields, radiation fields. In case of CyberKnife, we can use 200 and 250 different fields. And that means we can concentrate on the tumor itself.
So you attack the tumora from a lot of fields?
Sparing normal tissues and organs maximally.
So you say that you can attack only the tumora?
That's correct.
Better than irradiating a lot of around the tumora.
Yes. How do we do this? I mean, we take very thin slices of CT. We have a CT-based planning, but we also use MR images and PET scan for diagnosis, for staging, for follow-up, and for planning. And those opportunities help us a lot because we can make the treatment planning much precisely towards the tumor, and we on each CT slice we delineate the tumor and the nearby normal tissues and organs, and we know the tolerance doses of the nearby organs and tissues, so we can prescribe the dose, maximal dose to the tumor without exceeding tolerance doses to the
so you don't hurt the body, you focus only on the tumora. When I first heard about CyberKnife, I imagine it's a knife, but it's more like a gun from cyberspace fighting movies. It's like a shot and you go directly there. But how many times you have to go on the tumora? How many times you have to shoot? Because we have now the images. How many times?
It depends on the planning, the tumor size. This is a lung case animation. As you see, on each irradiation, we can take images, digital images, and we can compare the digital images at that point with the previously reconstructed images. If
to see how it works.
Yes, if there is any variation more than 1 millimeter, the device refuses to go ahead. So we should reposition the patient.
Interesting.
The other most important characteristic of the device is that the device takes into consideration the motion due to breathing and internal organ.
Because every organ is moving, yeah, like we see here. So this is how you radiated the tumor from different fields.
With conventional radiation therapy, you can miss, in some cases, the tumor because of the motion due to breathing, or also we have motions due to internal organs.
But how big might be the tumor to fight efficiently with your CyberKnife?
It depends on the location. Then let me try to explain the indications. This device can be used in all locations. We can use
brain
tumors, and we can use for benign brain tumors such as acoustic neurinoma, meningioma, or arteriovenous malformations. Those are benign lesions, but because of the danger for surgery, we can easily use CyberKnife without hurting any.
So sometimes you don't use surgery, you use only CyberKnife. Sometimes you use surgery and then CyberKnife.
In some cases, yes. We have certain CyberKnife boards in case of brain lesions. We discuss the patient with our neurosurgeon and our physicist, so we decide all together.
So what you are saying is that you are using the CyberKnife, but each time you discuss with the specialty what you fight against.
On each case, yes.
On each case. Okay. And could you tell me, is it expensive, such a CyberKnife, that we can find only few CyberKnives in Europe?
Well, you mean the investment?
The investment to have such a center, because it's important. Because maybe in a few years we also could fight here in Romania with our government to provide at least few, or at least one.
It's an expensive investment, but we believe it's very well worth purchasing. And soon in the future, as you say, it's bound to grow, the countries that have it. But if you're asking about the treatment itself, for a foreign patient who is traveling for CyberKnife, especially our center, we can say we can give package prices for every treatment, and we are moderately priced when you compare it to the other centers in Europe. I can easily say it's almost 40% less than the price in other centers in Europe.
That's very important.
Very beneficial.
And we have to say that Istanbul is only a few hours let's say by ambulance. Maybe 10 hours, I'm not sure.
10 hours.
Maybe 10 hours, yeah, and only 1 hour by plane. Or by helicopter, maybe let's say 2 hours by helicopter.
Exactly. So it's very convenient.
It's very convenient.
And we have an international airport that's very close to our hospital as well. So, we always have driver and car that's arranged to pick up our patients once they are coming. The minute they step off the plane, they are our guests, and we never leave them alone. We pick them up from the airport, we drop them back to the airport.
So, as you can say in tourism, it's all-inclusive, because you do great tourism in Turkey. So it's all-inclusive, yeah? As soon as you know the case, you have all the documents.
Exactly. Once the patient makes up his mind to come, we are there to serve.
And I can tell you something, you are very lucky with Romanians, because we have very good doctors in Romania who, if they don't have the technology, at least they have the good diagnosis, let's say, have the best diagnosis. I've heard from other doctors, foreign doctors, telling me that we have very good Romanian doctors.